Yeah, man, good evening, Delvin Sadler, you know that I am here. Yeah, man, Delvin there. Straight up. Always looking forward to see and hear from you. Yeah, man. Always looking to come here and do the show on a daily basis. And today is, yeah, man. No, like, it's the same. Yeah. Yeah, man. I always have this joy and feeling when I take up this what you call it, no, iPad device to actually talk to you guys. Big up yourself, Tiffany. Big up yourself, Michael Clark. Big up yourself. Yeah, man, happy Friday. Happy Friday. And another edition of Unscripted Anything Goes. Yeah, man, straight up. Yeah, man, big up yourself, Shanti. Yeah, man, my girlfriend that I love her so much. Big up yourself, girl. I love you. One and only. Straight up. Yeah, man, that's my one and only there. Straight up. I love you, girl. Yeah, man. Big up yourself, Tiffany. Yeah, man. Yeah, man. I love you, girl. That's my one and only, Tiffany. Yeah, man, I love you always. Straight from the heart. Always. Yeah, man. Straight up. Yeah. Yeah, man. Debbie and I, we had a little, I had to actually raise my voice a couple decibel at Debbie last night. Not in a very derogatory way, but in a correctable way. You know what I mean? So, apparently, she ran out of the room now because she thought I was raising my voice at her. But Delvin already, like, yeah, man, I deal with Debbie like I'm dealing with, like, my kids, them, You have to correct her when you have to. You have to hug her when you have to. Yeah, man, you have to, Yeah, man, but I love her same way, She's my one and only. Yeah, man, tonight we're talking about STIs, sexual transmitted infections that's associated with oral sex. Yeah, her point is that she wanted me to talk about that yesterday instead of talking about the the health benefits of oral sex yesterday. So she keep interrupting, even though we had agreed that I would do the health benefits. So I had to, and she quoted me 2 times incorrectly. So, Delvin already, in a very nice way with love, I had to correct her. And she didn't like it. But she should come in the room later, man. She, that's water under the bridge. You know what I mean? We're big people and that. The big can't hold that, So it go. Marcia Scott, big up yourself. Yeah, man, that's my one and only, Marcia Scott. I love you. I love you, girl. Yeah, man, straight up from my heart. You're my one and only. Yeah, man, there's no other like you. Yeah, man, straight up. Yeah, man, so this is the show called Unscripted Anything Goes. The show called Unscripted Anything Goes. The show called Unscripted Anything Goes. Unscripted Anything Goes. Yeah, man. Yeah, man. How much one and only you have, sir? Yeah, man. Every girl is my girl, Yeah, man. Every girl is my girl, man. All when they belong to somebody else, I'm my girl, man. And the second time somebody asked me the question, how much one and only? Yeah, man. Every girl is my girl, man. Yeah, man. I love every girl, man. Yeah, man. Straight from my heart. As if they're my girl. Yeah, man. So if your man leave you and all them something here, Delvin will love you. You can bank on the fact that Delvin will love you. Yeah, man. The girls, them, yeah, man, they belong right in my heart, Straight up! And that me say, girls for me, man. Whatever a person desires in life, that's their prerogative. But I love girls, and I can understand why girls love girls. Because I love girls. So I can understand why girls love girls. Because I love girls. Big up yourself, Sharika Foster. Yeah, man. Big up yourself. Yeah. Big up yourself, Sharika Foster. Yeah, man. My one and only that. Straight up, my one and only Sharika Foster. I will always love you, girl. Always. Straight from my heart. Yeah. Yeah, man. I will take no other but you. Yeah, man. Straight up. Yeah, man. Big up yourself, girl. I love you. Yeah. Yeah, man. Straight up, my one and only Sharika Foster, you know. So today's topic is all about STIs. It's sexual transmitted infection. That's what I call it. That you can get from doing oral sex. Yeah. But let me put out a disclaimer here. Yeah, man, one and only. Always. You're always my one and only. Yeah, man, always. Always. Yeah, man, for you, yeah, man, I'll take another. I will never take another, just you alone. Yeah, man. Big up yourself, Dwayne Williams. Bless up. At first, I see that room still, but bless up, man. Welcome to Unscripted Anything Goes. Yeah, man. Yeah, man, Tiffany, you know, say you're my one and only, Tiffany. Don't worry yourself, man. I would never take another but you. Never. Never. Delvin will take another but you. Always my one and only. Always. Yeah. Yo. Yeah, man. Yeah, man. Know yourself. Dean will. Yeah, man. Dean, big up yourself. Yeah, man. Yo, what kind of face that? Yeah, man. Big up yourself, Dimples. Yeah, man. You Dimple, big up yourself, my Genevieve, man. Straight out of England there. Yeah, man, I'm a girlfriend that. One and only. Yeah, Dimple, you have a one and only. You don't know that already. Yeah, man. No girl can't stand up in your shoes. Yeah, man. One and only that. Straight from my heart. Never take another but you. Never. Never, you know. Yeah. Oral, yeah, STIs, yeah. Big up yourself, Colin Mason. Yeah, man, one and only that. Yeah, man, one and only, Colin Mason. Straight up, I love her with all my heart and soul. I'll never love another but her. Yeah, I tell you that. Straight up, girl. I love you, girl. Please, I love you. Yeah, man. You don't have to worry. You have my heart. Can tell you that. Straight up. Yeah, man. So STIs we're dealing tonight from oral sex, that it is possible. And let me tell you this now. Let me put out a disclaimer here. All right. Yeah, I'm not a medical doctor. I'm not a medical practitioner. I'm not an expert in this matter. All right. Anything that I say tonight, I actually decided not to make notes tonight. Yeah, I decided not to make notes, but I borrowed my son's iPad, so I'm gonna read it directly from the iPad. Yeah, normally I don't do those things. I like to actually have my own creativity and style when I do my thing. Yeah, but tonight I'm gonna read directly from the iPad, so you can actually go online on the same site that I'm gonna read, and I'm gonna tell you to, so you can actually follow along. Yeah. I decided to read from this specific site. This one, in addition to others, some touch some things, and then this one touch everything. So I'm going to tell you exactly where to go, and then you can actually read along with me as well. So I'm going to read directly from the site tonight. Yeah, man. Yeah. Oh, you come from Lyson? Oh, yeah, sir. You come from Lyson, girl. Yeah, man, you're not too far from me still, now, about 1 hour and a half from me still drive. From Bull Bay, you know? Bull Bay area there. Yeah, man. Sharika. Yeah, man. Big up yourself, man. Come back. So we're gonna actually talk about STIs tonight that's associated with oral sex. Also, what I want you to know is this, okay? Yeah. You must make sure that your partner get tested. Yeah, for STIs. Yeah, make sure you go to the doctor and you do a full physical where they check you for all sexual transmitted diseases and infections. Yeah, I'm going to tell you that right now, because this is the key. Because if you're clean and your partner is clean, you can actually eat away as often as possible. You can eat away as often as possible. You can blow him away as often as possible. You can dive into the vagina as often as possible, as Delvin do. Yeah, you can do that. Yeah, but make sure that you are clean. And if both of you are clean, enjoy it. Enjoy it. Yeah, man, enjoy it. It was made for you to partake in it orally and penetrate as well. Yeah, man, nothing is wrong with it. Yeah, nothing is wrong with it. Delvin, do it as often as possible. Yes. Yeah. So don't be going down on people that you don't know. And if you do go down, decide to go down, interview them first to cover your ass. When last have you done a physical? Have you been tested for all sexual transmitted infections? And what are the results of it? Yeah, that's how you should conduct your interviews with people. You know, so there's no confusion. So there's no confusion as to you're clean and they are clean. Yeah. Yeah, man, do that, man. Do that. Yeah, do that. Especially the female them, please. Yeah, man, take the time and, you know, get the chance to actually know your partner. You know what I mean? Yeah. Straight up. Yeah, man. And, you know, don't be conducting oral sex on anybody unless you trust them. Yeah. You know what I mean? Yes. That's my advice to you. So with that said, we're going to get right into the show. All right? So we're going to talk about sexual transmitted infection that you can actually get from right. So if you go on Google and type in the net doctor, right? If you go on Google and you type in infection risk associated with oral sex, yeah, infection risk associated with oral sex. You can type that in Google, and it will come up with the net doctor. And that site has everything that I see on other sites. And this is by Dr. David Delvin. Dr. David Delvin actually put this together. So yeah. So you can actually follow along with me as I read. So you know that this is actually what I'm reading. So you validate what I'm reading. And it is from the net. Alright? So it says oral sex now widely practiced in both heterosexual and homosexual relationships. For many years it's regarded as an almost unmentionable activity. But these days research suggests that most sexual activity, people go in for it sometimes. In 2013, National Sexual Attitude and Lifestyle Survey announced that in all age group except the over 65, the majority of people now say that they have oral sex. Yes, good evening, Denise. D-Mac, big up yourself. Yeah, man, this is Unscripted Anything Goes. Yeah, man, big up yourself, girl. I love you. Straight up, straight from my heart, you know? One and only that. Yeah, man, straight up. So we're talking about sexual transmission infection tonight. So yeah, so I'm reading directly from the site, and you can follow along to DMAC. This is from the Net Doctor, sexual transmitted infection. This is by Dr. David Delvin. Yeah, my Dr. David Delvin. Look at that, David Delvin. Yeah, and this was posted by in March 1st of this year. So you can actually follow along on that. So he said most people practice oral sex. 70% of people, 70% of age between 16 and 24 practice oral sex, and 80% of adults between 24 and 34 practice oral sex. So it's a huge percentage of people out there that practice oral sex. And we did define that fellatio is when the woman actually gives the man a blowjob. That is called fellatio. So that is from the woman's point of view, and when the man actually goes down on the woman, it's called cunnilingus. So we established that yesterday. So your partner and you, man, you do cunnilingus, and the woman, you actually do fellatio on the man. So those are the proper terminology for oral sex by each individuals. Okay, so it is very extraordinary effect to help women to reach a climax. Oral sex is very good for a woman to reach climax. It can help men to have who have minor difficulty getting an erection. So, you know, if you have issues getting an erection, if you have if you have your wife blow you, yeah, your girlfriend, you can get an. It might help. It might help. Yeah, and you will maintain the erection for the actually what do you call now, fellatio. Yeah, if it good, if it good. Yeah, man. And what it says here is that oral sex can't get people pregnant. So if you worry about getting pregnant through oral sex, ladies, I don't mean to blow your toot your horn. You cannot get pregnant from oral sex. So when the semen is ejaculated in your mouth, you can swallow it, and you will not get pregnant. And yesterday we talked about a lot of the health benefit that you get from swallowing semen. Yeah, it's very healthy. Go ahead, blow away and swallow. Blow away and swallow. Yeah, that's what you should do, ladies. Don't let it waste, because the best part of the oral sex for you ladies is actually you swallowing. There's a lot of health benefits to it. Yes, Natasha Johnson, welcome to Unscripted Anything Goes. Tonight we're talking about STI, sexual transmitted infections that associated that you could possibly receive from doing oral sex. Last night we touched on the health benefits. Tonight we're talking about the risk. Yeah man. So straight up, you cannot be pregnant from oral sex. So yeah, blow away, ladies, blow away. But make sure you swallow the semen, because it's very healthy for you. All right, but make sure your partner is clean first before you do that. All right, yeah, straight up. However, a lot of people do get concerned about oral sex. Yeah, they do wonder if you can actually get sexual transmitted infection for it. And so they're saying yes, you can get it. Yeah man. They point out that there appears to be some significant risk acquired from significant risk of acquiring chlamydia, gonorrhea through sexual activities. Yeah, in this article we'll look at we talk about what is oral sex already. So let's go down here. Yeah, so you can actually get it from you can get these diseases that I'm gonna mention now from oral sex, or Oreo. Or Oreo. Yeah, you know what Oreo is? Oreo is actually anal sex. Yeah, the tossing of the salad. You can actually get STIs from that. Yeah, if the anus is not clean, and if the person is actually does have infection. So you can actually get sexual transmitted infection from that. So make sure that the person wash themselves properly and that they don't have any infection before you decide to put your mouth on the rectum area. Yeah, you can actually get that what I think that we talked about earlier yesterday. Yeah, forgot about it, but I'm gonna read about it later. Yeah, the papilloma virus. You can get that from the anus if the person's is not clean back there, or if they have the virus, the papilloma virus itself. So make sure that you're talking to somebody that's you're having sex with somebody that's clean, and not only that, you are clean as well. Yeah man, and them clean, them wash themselves properly with soap and water. Yeah. All right, HIV infection. Now let's talk about what it says about HIV. Yeah man, it's possible to get HIV from oral sex. However, it minutely happen. It don't happen on a regular basis. Okay, HIV can be transmitted by oral sex though it does not happen frequently. It says it doesn't happen frequently, but it can. Both fellatio and cunnilingus have been known to pass it on. They have been known to pass it on in the past. Okay. Oral sex is certainly much safer. Oral sex is certainly much safer, HIV wise, other than rectal or anal sex. Yeah. So, well, if you're doing oral sex, it says your chances of getting HIV reduces as opposed to if you add anal sex. You can get it HIV at a higher rate than doing oral sex. Yeah, that's what it's saying here. So, but if you're doing anal sex with anyone, I would suggest you use a condom. If that's what your thing is, use a condom. Unless it's your wife or your girlfriend that, both of you have, committed to each other and you guys are not fooling around and you guys are clean, then you can go ahead and do anal sex unprotected. Yeah. Oral sex is probably safer than vaginal intercourse. I would say it's a lot safer, but I mean, there's risk involved there. It says ulcer in the mouth could increase the risk. So if you have ulcer in your mouth, you can actually easily you increase your risk of attaining HIV. Your chances goes up that you can get it through that. Yeah. So yeah, because ulcer is an infection that is in your mouth. So therefore, and it must be treated. And if you constantly have that now, with the fluid from the vagina or the penis, you can actually transmit it that way if they have a breakage in the skin or anything like that. Big up yourself, DJ Shakur, my brother, my son. I love you, brother. Yeah, man. Thanks for joining Unscripted Anything Goes. So tonight we're talking about STIs associated with oral sex. So these are what is on the Net Doctor page, Dr. David Delvin. Google that, you will find it. And you can read along with me. Instead of me just telling you what the information is, you can follow. So that's the format I decided to use tonight. Normally I read several sources and make my own notes, but this guy has like everything on there that's on all the sites that I've read. So I decided to just go with this one tonight and just read it because I didn't have time to actually read it and then write notes and all of these things. That's gonna take me a long time. So I decided to do it this way tonight, and you can actually follow one. Yeah. It says during fellatio. This is when the woman is giving you a blowjob, when she's blowing your way. Yeah, big up yourself, Jacinta, my wife. I love you. Yeah, man, one and only. Straight up. Thanks for joining Unscripted Anything Goes. Yeah. So when the lady is giving you fellatio, if the man avoid ejaculation, it's probably reduce the risk of somewhat. So let's say you are actually giving your man a blowjob, then your risk reduces if you don't let him ejaculate in your mouth. Yeah, your risk reduces. Yeah, because now the fluid carries the infection to your mouth, and if you have a breakage in the skin in the mouth, then you can, you run your risk of actually it transmitting to you that way. Yeah, so don't let him ejaculate in your mouth if you know, say. No, but if you know him have HIV, you wouldn't want to do that anyways. Yeah, unless it's your husband, probably. Use what do you call it now? A flavored condom or something like that. Yeah, man, straight up. So yeah, so the risk goes up if he ejaculates in your mouth. But if he doesn't ejaculate in your mouth, then it's a smaller risk, but it's also a risk. It's possible. Yeah. All right. Yeah, man. In the case that of cunnilingus, all right. In the case of cunnilingus, like that's what women do to the woman. There may be increased risk of transmitting if the woman is on her menstruation. Yeah, so if the woman is on her menstruation, it's a higher risk because you're dealing with blood, and in the blood it contains the disease or infection. So therefore, it's easily transmitted to you through the mouth if you have a breakage in the skin or in your teeth. You brush your teeth. There's sometimes you leave a bruise that, yeah, it can easily transmit it through those avenues. Yeah, breakage under the tongue, on the tongue. Yeah, yeah. The blood now, because it carries it now, it's now transmitted through in that area. So yeah, if she's on her menstruation, yeah, yeah. Some of you guys like to do that during menstruation. If you like it, then go ahead. But do it with your spouse. As long as they're clean, you can go ahead and have oral sex during menstruation. Nothing is wrong with it. But if a lot of people think it's nasty or dirty, that's your prerogative. How you and your spouse want to live. But if you're doing those things, make sure you're clean. And if you're not doing it, then power to you. You don't have to worry about it. All right. So straight up. It says here, using a condom or dental dams during oral sex could reduce the chances of infection, but not eliminate them. So yeah, you can use the condom or dental dams, but there's still a chance that the fluid can actually get on the dental dam and get in your mouth still, or it can actually you can actually break the condom, and it comes through the condom and you get it, or something seep around and it goes down the condom, and actually those fluids get in your mouth, the semen, and you could pass it that way. So with regards to HIV, high risk involved if you're infected. So don't do it if you know the person is infected. All right, and take precaution. Yeah, take precaution. Interview the person before you have sex with them. Make sure that they've done their physical. Make sure that they're clean. You make sure that you're clean and you pass it on to them. And therefore, you don't have to worry about it if both of you have not been exposed to HIV. So, yeah, straight up. Big up yourself, everybody. Yeah, man, straight up. All right, it says that gonorrhea, gonorrhea, yeah, it's a common STD, can be transmitted through the throat during oral sex. It can be transmitted, especially fellatio, for the woman them who's blowing the man them. Yeah, because of this fact, gum clinics often take throat swabs these days. In the throat, the germ can cause inflammation, formation of pus, and sometimes soreness. Yeah. So blah 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 blah. Yeah. So if you know somebody have gonorrhea, if you don't have gonorrhea, don't blow them, ladies. Yeah, don't blow them. Yeah, don't blow them. Yeah, please don't blow them. Let them go to the doctor and get it taken care of, and then you can blow them after. Yeah, you know what I mean? So use a condom. Yeah, in that case, if you can't wait out. But please, yeah, take every precaution to not be exposed to gonorrhea. Yeah, man. It says you can also get syphilis. Syphilis is it's a lesion usually appear on the genital or anus, and very rarely on nipples, but they do sometimes appear on lips and tongues. Yeah, you have mouth syphilis as a result of oral sex, and the disease can be caught from an infected person's mouth. So if they have mouth syphilis, you can actually get it from them. You can actually get it from them. Yeah, man, please bear in mind that much of the blah, 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 you don't need to read all of that. Yeah, so if the person have syphilis, right? If they have syphilis, I wouldn't advise you to have oral sex with them. Unless you have syphilis too. Yeah, man, unless you have syphilis. I would say don't do it. Yeah, so as I said again, communication is is the key when you're talking to a sex partner. You have to make sure that they're clean as well as you are clean. So you talk about their medical history when it comes to STIs. Have they gone to their doctor? Have they got a full physical done with regards to STIs, so that you can be assured that they're clean when you're sleeping with them? If you're in doubt, use a condom. Use a condom, a flavored condom, or dental dams. Yeah, use those things. to reduce the risk. Okay? Or abstain. Don't have sex with them until they go to the doctor and produce to you, that they're clean. If you're in doubt, don't bother. If you're in doubt, don't bother. I'm telling you that. Yeah, that's the best thing. You can also get chlamydia from oral sex. Yeah, man. Chlamydia is a little genital bug that's become almost epidemic among sexually active young people during the early 21st century. It's estimated that in some parts of the UK, at least 10% of young adults have it. So that's a very high rate. You know, chlamydia is a very high rate. So I remember when I was in my teenage years, I was about 18. Yeah, I used to have a girlfriend. Yeah, 18 or 19. Yeah, I used to have a girlfriend, and just before I met her, she had caught chlamydia from somebody, but she went to the doctor and got treated and all of that. You know what I mean? And she did tell me that about it. She was upfront about that. She did get it and she got treated and she's clean and everything. Yeah. But after she now died still, her man killed her. You know? But after we broke up and we moved on with her life and everything, I went to the doctor. Yeah, I went to the doctor. There wasn't any sign or anything, but I went to the doctor and I tell him that, I had an ex-girlfriend who had chlamydia and I don't know. She told me that she, got cleaned and everything, but I want to be tested for it to see if I had it. So I asked to be tested for every single thing, and I came back clean, so I didn't have it, so I never had to worry about it. So, but those are the things that are in your back of your mind when you talk to people. Yeah, when they tell you something, you go to the doctor and you check it out. That is the good thing about my wife and I. We go to doctors. We love doctor. Our doctor, a nice doctor. And the good thing about it is very thorough. When you go there for one thing, he test you for 10 things. Yeah, man. So that's how I like my doctor. You go there for one thing, you're leaving with about 10 vial of blood gone. Yeah, because he's testing for everything to make sure that you're healthy. And that's how I want my doctor to be on top of my medical situation and my wife's medical situation. So we go to the doctor and we get tested all the time. Every single year we get tested. Sometimes, because my wife, she goes to him more than me. Sometimes she gets tested all 2-3 times for the year. All 2-3 times for the year she get tested. Cause she love doctor. Yeah, and I like that, I like that. Yeah, man. You test for everything. So he went just to test for some blood sugar reading. He's testing everything. Yeah, all over again, even though you did it before. So that's how you should be on top of things with your doctor. Your doctor is quite thorough, So you would be checking for all of these things to make sure you're clean, So I am clean. My wife is clean. Yeah, so you make sure that you are clean and you make sure that your spouse is clean. So that when you know that you're having sex with them, that you're having sex with a clean person, you're having oral sex with a clean person, and that is your spouse, that is your wife. Yeah, you enjoy it. Yeah, dive in. Let her blow you away, and you suck away, eat away, and fulfill her needs orally as she requires. Yeah, man, straight up. So with the chlamydia now, yeah, man, it is possible that you can actually get it from oral sex. Yeah, man. Yeah, man. So it talks about gay men and chlamydia here. I'm not going to talk about gays because none of them is in this room. Yeah, none of them is in this room. It's all freaky people in this room. Freaky sexual people. Yeah. Yeah, man, because, this is a room where we welcome freaks. Yeah, man, we welcome them because Delvin himself is a freak. So you don't have to feel ostracized, isolated. Yeah, being pushed aside in a corner. Yeah, no, you're welcome here. Yeah, we're born this way. We're born as freaks. Yeah, people think there's something wrong with us, but nothing is wrong with us. Delvin is telling you that. Yeah, we're born sexually with high sex drives. And sometimes it's hard for people to understand, or it leaves you completed. Why aren't you fully satisfied? Why do you constantly want more? It's because we're born that way. You know what I mean? We're born that way. Yeah. If other people can say that they were born that way, why we can't say we're born that way and be proud of it and be proud of who we are? Yeah, we were born freaks. And here you can be as freaky as you want to be. Yeah, in this room, yeah man, yeah man, yeah man, yeah man, freak peacefully. Yeah man, freak peacefully. You can freak peacefully in this room as you want. Yeah man, express yourself openly. It's all freaks here. Straight up. Big up yourself, Alison Clark. Yeah man, I love you. You're my one and only, you know. Thanks for joining Unscripted Anything Goes. We're talking about tonight STIs that you can get from oral sex. Yeah man. Yeah man, big up yourself, Bobette. Yeah man. Yeah man, big up yourself, my girl, my one and only. Thanks for joining. Unscripted Anything Goes. Yeah man, tonight, yeah, we're talking about STIs, sexual transmitted infections that are possible through oral sex. Yeah, so we touch on the HIV, we touch on the syphilis, we touch on chlamydia. Yeah man, we touch on chlamydia. Also from Oreo, the Oreo sex thing we talk about. You can actually get STIs from Oreo. That is the anal sex, anal oral. That means you like to please your spouse orally by actually tossing their salad. Yeah, that means, yeah, sucking on the genital, on the anus area around there. Yeah, you toss the salad. That's what the traditional word that is used, not the official word, but the word that is the slang to deal with that, the tossing of the salad. Yeah, so people like that. A lot of people like that. Yeah, there's a lot of pleasure zones around there that people in the privacy of their home do. So if you don't do it, yeah, power to you. But for those people that do it, well, oh my God, what's wrong with that, Bobette? Nothing is wrong with that. Yeah, tossing the salad is good. Yeah, people do it. There's a reason why they do it, because they get pleasure out of it. You might not do it, but if they do it, then so be it. It's a good thing, you know? It's a good thing. What's pleasurable to you might not be pleasurable to someone else. What pleasurable to me might not be pleasurable to somebody else. But if they find pleasure in it, yeah man, it's good. And we still have to talk about it, even though you might not do it or I might not do it. Yeah, or we might do it. Yeah, you know? So we still have to talk about it. The highly enlightened, big up yourself, my girl. I love you. Straight up. Yeah man, unscripted anything goes. Yeah man, but yeah, so that's their pleasure. So we can't point fingers. All we have to do is just tell of the risk. So there is the risk of STIs for those that toss salad. Yeah. So first of all, you have to actually you have to make sure that you're clean, that you get tested. You know, and keep stressing you have to get tested to make sure that you're clean and that your partner is clean as well. Big up yourself, Devon, my brother. Yeah man. Welcome to Unscripted Anything Goes. Tonight we're talking about the risks that are associated with and the STIs that you can get from oral sex. Yeah, straight up. Yeah man. So yeah, where are we now? Yeah, it says here, as we've indicated above, blah, 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 result in transmitted bottom germs, blah, blah, blah. But it's now clear that the dangers of bowel organisms, salmonella. You can get actual salmonella exposure from tossing salad, from sucking on the genital, from sucking on the anus. You can get salmonella from it. That means, you know, if you're gonna do those things, make sure that the bum is clean. You wash it thoroughly. You know, it's preferably if you take your pass stool. Yeah, it's best if you pass stool first, and then you wash it cleared cleanly, and then you can easily go ahead and partake in it. Yeah, if you want that, if you were one of those to do it. So it must be clean thoroughly before you partake in it, or else you're taking the risk of getting salmonella. And also Shigella and Campylobacteria can be transmitted to Oreo, or what you call tossing the salad, the eating of the rectum. Yeah, Shigella cause severe stomach cramps. So Shigella cause severe stomach cramps. So if you get that through the rectum, it can lead to severe stomach cramp. You can get diarrhea or fever as a result of that. So please, people, if you're gonna do oral sex from on the anus, make sure that you actually wash yourself properly. Yeah, man, make sure you wash yourself properly, Please make sure you wash yourself properly. Pass stool first, and then wash yourself properly, thoroughly. And then you can partake in it. You can partake in it if that's what you like. Yeah. Yeah, man, partake of it. Yeah, man, big up yourself there. Yeah, man, of course you can partake in it. Big up yourself, Michelle Sand. Big up yourself, my girl, one and only. I love your girl. Thanks for joining. Unscripted Anything Goes. Yeah, man, we're talking about the risk STIs that you can get from oral sex. Yeah, man. So that was the anus aspect of it. Now you can also get hepatitis A from oral sex. Yeah, you can also get that. But as I said before, if you're going to have oral sex with anyone, make sure both of you are clean. Go and visit your doctor, get yourself tested for all STIs. Because a clean person is only right to be for the spouse or your partner. Yeah. So both of you go to the doctor, get tested. And if both of you are clean, go ahead. Dive in. Yeah. Ladies, blow away. Man, dive head first. And enjoy. Because it is good. It is good. But make sure you're clean. Yeah, make sure you're clean. Make sure you're clean. That's all I'm asking. Yeah. That's all I'm asking. You don't want to catch something that is going to be a lifetime problem when all you had to do was to go and get tested and get your actually medicine, or what do you call pills, and take care of the problem if you do have a problem. All right, so please, so STIs, you can hepatitis A, you can actually get that from oral sex. Yeah, man. The word hepatitis. Big up yourself, Asheen. Big up yourself, Asheen, my one and only. I love you, girl. Thanks for joining. Yeah, thanks for joining. Unscripted Anything Goes. Tonight we're talking about STIs that you can get, sexual transmitted infections from oral sex. Yeah, man, true. Yeah, man, true, man. Yeah, man. Yeah, the word hepatitis means inflammatory of the liver. Yeah, inflammation of the liver. That is what hepatitis means. Yeah, hepatitis means. So hepatitis A is a common viral infection that can cause jaundice and abdominal pain. It is not usually life-threatening, although sufferers can feel very ill. Yeah, the virus is often found in the feces. Yeah, in high concentration, and will almost inevitably be present on. Oh shit. Yeah. Present on the apparent clean anus skin an infected individual. It can be transmitted through the anal contact. That means the tossing of the salad. Yeah, so if you have hepatitis A, if you go to the doctor and he says that you has hepatitis A, it is always in your feces. Therefore, you should not have anyone tossing your salad. Oh, you never heard of those before? Hepatitis? No, man. I get my shots for those, Yeah, man. We get our shots for those at our job. We have to get them shots there. Hepatitis A and hepatitis B. Yeah, I get my shots them. Mine are complete. Yeah, cause you can get it from spitting too. Somebody can spit at you and it pass through your skin if you have a breakage and you get it. So we get those shots at work. Yeah. Yeah, man. But you can actually get the hepatitis. You know, it's highly concentrated in the feces. So if you have somebody, let's say your butt is dirty, and you know, fecal matter is something that is constantly in the anal area. So even if you clean the rectum, the residue of it is constantly there. Yeah. So yeah, if you have hepatitis A, more than likely you'll transmit it to somebody because it's highly concentrated within the feces. So don't let anyone suck on your feces, suck on your anus if you have hepatitis A. Please, I'm begging you, don't let anybody do that. That's very wicked if you do that. Yeah, don't let them do that. Yeah, it's highly concentrated in that area, so don't do it. Yeah, there's other oral aspect you can do, like the what you call it now, the sucking of the genital area. Do that one. Yeah. Yeah, fellatio and cunnilingus. Do those ones. Yeah, man. Yeah, right. So several epidemic outbreak has been reported amongst gay men. So a lot of gay men, they do the Oreo thing. They suck the anus, toss salad. So you find that there was a lot of outbreak in that community of hepatitis A, because of that. You know, they do that a lot. Yeah. You know, there's nothing wrong with doing it, but you got to be clean. Got to be clean. You and your spouse must be clean. All right. So you can also get hepatitis B. You can get hepatitis B from oral sex. Yeah, man. So hepatitis B is also a viral infection. It's common in hot countries and around the Mediterranean. It used to be rare in the UK, but the rates are rising. That's what it says. In particular, common among people who have had previous sexual transmitted disease and among drug users. So you find this prevalent in people who had sexual transmitted diseases before and are previous drug users. It can cause very serious potential fatal liver disease and chronic liver damage. Yeah. It is most commonly transmitted by inoculation of the infected blood by sharing needles or injections, needle sticks, injuries, and medical use of infected blood products. So virus can be found in semen. So you can actually have the hepatitis B in the semen. Yeah. It also can be found in the stool and in the saliva, as well as in the blood. Yeah, there is a clear evidence that it can be transmitted through vaginal and anal intercourse. All right, but it is unproven whether it can be transmitted through oral sex. All right, so certainly there is a theoretical risk. There's no proof that it can be transmitted through oral sex, but theoretically, they're saying that once you're having sex, you know, the risk is there. Yeah, the risk is there. So if you have hepatitis B, yeah, please use condoms. Yeah, use condoms because it's in the semen. So once you do the oral sex, it's possible, you know, with breakage in the skin and the mouth and all that, it's possible. There's no scientific proof that it has, but it's possible. Make sure you use a flavored condom when you do that. Yeah, please. Yeah, and when you have sex, make sure you use condom because it can be transmitted through vaginal intercourse by the ejaculation of the semen inside of the vagina. So, please, people, hepatitis B people. Hepatitis B people. Yeah, man. Yeah, man, practice safe sex. Go to the doctor. Yeah, yeah, man, straight up. Hepatitis C is another viral infection transmitted in a similar way as to hepatitis B and often affected drug users. Some people with hepatitis C infections were infected with blood products, such as transfusion, prior to adequate screening in the 80s. In 2013, it was reported in the US study that the risk of catching hepatitis C through any kind of sex, including oral sex, was very low. Yeah, but it may be greater if you are HIV positive. All right, so you have a higher risk of catching hepatitis C if you're HIV positive, but for everybody else, it's very low risk of catching hepatitis C. So, yeah, but in everything it says here, yeah, there is a risk. All right, so that is what it says about hepatitis C. So, what about herpes now? So we talk about syphilis, we talk about gonorrhea, we talk about HIV, we talk about hepatitis A, B, and C. What about herpes? Herpes is a simple virus infection. Is commonly called genital ulceration. There are two types of the virus. The first type affect mainly the lips, so you can get lip herpes. A lot of people who smoke like weed or something like that and then pass it around, enough of them you see there have lip herpes. So if you see a man and him lip always sore up and then dry up and all them things, that he has lip herpes. He probably don't know that, but he has lip herpes. Don't let that man blow you. Please, ladies, don't make that man blow you. If you see a woman and she has, she smoke, and she has that, her lip always have something pan there and then it just dry up. Yeah, all the time it come and it goes. Don't let her blow you. She have lip herpes. So a lot of people who smoke and pass the thing around, enough of them have lip herpes. If you're going to smoke your own spliff. Smoke your own cigarette. Don't share it with nobody. Yeah, because they could be passing lip herpes to you. Okay? So that is the lip herpes. And it's like a cold sore like. Yeah, the second type caused by blistering of the genitals. So on the genital area, you find that you get these bumps that come up that looks like water bumps. Yeah, and then it flare up and get red, and then it start burn you. You scratch it, yeah, and then it turn into the water break out of it and it dry up and it go back in. So that is called if you see a man with that or a woman with that on their genitals, that is called vaginal herpes. So yeah, I would say if you have any form of bumps in your private area, the genitals, go and see the doctor immediately. Yeah, any form of bumps in your private area, go and see the doctor immediately. Yeah, don't wait for somebody to point out there's a bump right there. No, I'm not having sex with you because those bumps are there. No, you go to the doctor and get them deal with. Yeah. Because there's a medication that you can take to control the flare-ups. You know what I mean? So go and get it. And make sure you tell everybody that you are going to have a sexual relation with, that you do have it. That is the law. You have to disclose it to people. Yeah, in Canada here, you have to. You can be arrested for it and charged if you don't. Yeah. So make sure you tell people that you have vaginal herpes or lip herpes. Any sexual transmitted disease that you have. Yeah, man, straight up. Yeah, genital herpes is characterized by the recurrent bouts of vesicular, that is the small blisters, either on the penis or the vulva, or other parts of the female genital tracts. Yeah, these rapidly break down to form small, more painful ulcers. Yep. So you find that them get bigger and then they get smaller, smaller, smaller. Yeah, but they are more painful, the smaller ones. Yeah, straight up. Yeah, man, bumpy genitals with these. But I mean, I looked in the book and I see them because we were in L class when I was in high school. We had to go through all of these sexual transmitted disease, they call them at the time, but they now term them as infections. So in school, we used to go through all of these and we were tested on them. So I saw them in the books. They look gross. When you see it, yeah, it's not something that you cannot identify. You'll see it and know that's what it is once the flare-up occur. But you can have it, and because you don't have a flare-up, and it looks normal. Yeah, so now you would have to trust the person that you're with. And I don't think if you have, I don't think you can actually get it unless you have a breakage in the skin and one of those bus thing transfer to you, or the semen transfer to you as woman, then you can get it. So, yeah, but our fluids can actually give it to you as well. So I would say to you, I wouldn't take the risk in having sex with anyone with herpes. I wouldn't do that unless you want herpes too. Unless you want herpes too. So I wouldn't even take the risk in doing it, you know? Yeah. Use a condom. Yeah. Or don't do it. I'd say don't do it. It's up to you still. It's up to you. Yeah, I told you about my friend yesterday that he met this girl who introduced him to another girl. And then, yeah, he was going to have sex with the girl. And then the girl tell him, which was a good thing to do, that she has vaginal herpes. However, it is not contagious at the moment because there's no flare-ups. So I guess you can only get it once there's a flare-up. That's what I'm assuming that's what she was saying, because she wanted him to have the sex. But he did the right thing by saying, no, I'm not going to have sex with you. Sorry about it. Yeah, I'm on and everything, but no sex with you. So, I mean, I think she should find somebody who have herpes too and have sex with them. But that's discrimination. Who am I to tell her what to do? Somebody love her and want to take her on. I guess if they follow proper protocol, I don't know what that protocol is or are. Based upon the doctor recommendation, they can actually live a healthy life and they can have good sex. So if you have herpes, seek a medical practitioner and let them give you proper advice of how you can approach and deal with it. Yeah, man. Fresh Kitty Tango. Big up yourself, my brother. Big up yourself. Yeah, man. Straight up. Yeah, man. Straight up. We're talking about sexual transmitted infection that you can get. You could get from oral sex. Yes. Yeah, but first, you must go to your doctor and get yourself tested, checked out to make sure that you're clean. And also your partner should also do the same thing to make sure that you're clean so that you can actually have great oral sex if that's what you choose to do. Big up yourself, my one and only Beverly Bellamy. Yeah, man, straight up. I love you, girl. I love you. I love you. I love you. Yeah, man. I love you, man. Welcome to the show, man. Unscripted Anything Goes. We're talking about sexual transmitted infections that you can get from oral sex tonight. Yeah, man. Yeah, man. So last night we talked about the health benefits of oral sex. Tonight we're talking about infections. So we balance the thing. Yeah, we're not one-sided. So we're balancing the thing tonight. Yeah. Yeah, man. So, yeah. So if you have a cold sore on your lip, do not give anyone oral sex or even kiss them. Hear that? If you have cold sores, see, Delvin has no cold sores, so you can kiss me. Mwah, mwah, kiss Delvin. Yeah, so if you have cold sore on your lips, yeah, don't give any oral sex or don't kiss anyone. Yeah, because you can actually transmit. Yeah, yeah, big up yourself, girl. Yeah, man, you can actually transmit herpes. Yeah, to them by kissing them or giving them oral sex. So please don't do it, please. I'm begging you. Yeah, big up yourself, my girl. I love you. I love you. I'm accepting all of it, man. Straight. Yeah, straight. Yeah, I'm accepting every single one of them. Yeah, man. Straight up. Yeah, man. What about HPV? Yeah, and the risk of cancer. All right. HPV. All right. Let me read what it says here. I'm going to go verbatim right here from what it says. In 2010, I was alarmed when an ENT surgeon showed me the larynx voice box of a man who had a lot of oral sex partners. Yeah, and I think this is what Debbie was actually referring to the other night when she mentioned the throat in the cancer. All right. So this is what she was referring to. So that's why I'm going to read verbatim what it says here. Yeah, man, big up yourself. Yeah. So, yeah, he had a lot of oral sex partners. So it's not a partner, but he was actually having oral sex with a whole heap of different people. Right? Yeah. So the patient was hoarse and he found it difficult to speak, as Debbie was saying. So, yeah. The area around his voice cord was virtually swamped by a network of fine white threads. These, it transpired, were caused by HPV virus. Fortunately, he did recover. Okay, so you can recover from the HPV virus. I think it's popularly known as the yeah. You can recover from the HPV virus if you do have it in your throat. Okay, it's called throat cancer. So go to your doctor, the plastic surgeon, and they'll be able to help you with that. All right. But since then, it has become increasingly clear that today a high rate of oral sex are linked to the rising incidence of throat and mouth cancer. Yeah, man. Sydney, good night. Thanks for joining Unscripted Anything Goes. We're talking about oral sex, the STIs that you can get from doing it. Yeah. So you can get throat and mouth cancer from actually oral sex. Yep. Yeah. So the HPV is carried by many people. There are about 170 different strains of it. So there's a lot of strains of. Yeah, man. Good night, Sharon. Thanks for joining. Tonight we're talking about STIs, sexual transmitted infection that you can get from oral sex. Yeah. So HPV is carried by many people. There are 170 different strains of it. Some of them can cause warts, including genital warts. Others can cause cancer, notably cervical cancer, and also anal cancer. According to the American Association for Cancer Research, more than 50% of all oral cancers are now HPV related, though not many others are caused by tobacco or alcohol. Yeah. In the light of current evidence, it's clear that both men and women should now be trying to follow the policy of risk reduction where oral sex is concerned. So that means don't be taking the risk of having sex with people who are exposed to who are not clean, first of all. Yeah, that means they don't go to the doctor on a regular basis and get themselves checked out to make sure that they are not exposed to any STIs, and that if they do have STIs, you stay away from them, and also make sure that you clean your body before you actually partake into oral sex, so you're not picking up these STIs. Straight up. Yeah, man. Valid, good night. Big up yourself. Yeah, we're talking about STIs, sexual transmitted infection that you can get from oral sex. Yeah, so it's saying you can get the HPV virus from and it's a throat virus. Yeah, it's a cancer of the throat that you can get from oral sex when you have a whole bunch of partners. So some of them might have it and you don't know it and you pick it up from them. So know your partner. Make sure your partner get tested on a regular basis to make sure that you're not passing on these things to you. Straight up. It says avoid oral sex altogether is the only way of preventing infections by oral route. But because it's an important and enjoyable part of most couples' sexual repertoire, this advice is rather impractical. Limiting the number of sexual partners, you see that? You must limit the amount of sexual partner and not being pressured into casual oral sex with an unfamiliar partner is an important factor in reducing infection risk. That means you can't just go around having oral sex, like as Debbie had said, with every and anyone. Make sure that, you narrow it down to your household. Yeah, make sure you narrow it down to your household or your girlfriend or your boyfriend. Don't be going around oral sexing everybody. Yeah. Unless you know that all of you are clean. All of you guys have medical certificates to say that you're all clean. Then you can all dive in. But that is impossible. Yeah, all of you guys not gonna walk with medical certificate. No. But yeah, make sure you're having oral sex with people that are only clean. And if you're in doubt, don't do it. Yeah. Consider whether your partner may have or have had other sexual partners and what their infection status might be before you put yourself at any risk by giving them oral sex or receiving it from them. So you must consider what we just talked about, their history. So you sit down and interview them before you have sex with anyone. Interview people before you have sex with them. Straight up. It is possible to enjoy oral sex using some form of protection barriers. For fellatio, there is wide variety of flavored condoms available, ranging from strawberry to curry. Curry condom. You have curry condom? I didn't know you have curry condom. And from whiskey to larger limes. Yeah, to lager and limes. For cunnilingus, a dental dam. You can use dental dam for ladies, for the men who want to cunnilingus a girl them. Use dental dam, a thin plastic film that you put over the vagina, and you can actually give her cunnilingus that way. You can use that. So that's a protective device. Big up yourself, Clarence Clemenson. I love you, girl. My one and only. Straight up. Tonight we're talking about STIs that you can get from oral sex. Yeah, you could get from oral sex. Yeah, but in anything, you must go to your doctor and actually get yourself checked and get your partner checked to make sure that you're clean so you guys can enjoy oral sex together. Yeah. Having an anti-HPV vaccine should reduce the risk of catching HPV through oral sex. Yeah, so the doctors nowadays have vaccine for HPVs. So go and get your vaccine. Big up yourself, Knowledge Base KT. I love you, my brother. Yeah, man. Tonight we have talking about what you call what thing name again? In STIs that you can get from oral sex. Straight up. Yeah, man. Straight up, my brother. Yeah, man. Yeah, man. If you are concerned that you have or might be at risk of having sexual transmitted disease, it's important that you seek medical advice as soon as possible. Right away. If you feel like you're exposed or, you didn't know that the person had it before and they tell you, go to your doctor right away. Right away, you get tested. For real, right away, you get tested. It is the right thing to do. Yeah, man. It's the right thing to do to make sure that you have not been exposed, or if you have been exposed, get treatment right away. Straight up. Yeah, man. Finally, you feel that you have taken a risk with oral sex, go to your local genitoria medical medicine clinic. They'll gladly give you a checkup plus the throat swab if necessary. So I guess you go to your clinic. I would say go to your doctor. Yeah, go to your doctor. You know what I mean? And have them check you out properly and thoroughly and swab you to make sure that you're not exposed to HPV. You know what I mean? So yeah. So that is those are the actual those are the actual ones that are listed on this side, and this side was more thorough with the amount of things that you can get. I find in looking at the other sides, they have some of these, but this one have everything encompassed, and you can go and check it out for yourself. I would advise you to go and check it out. It's called the Neck Doctor, Dr. David Delvin. Yeah, his last name is my first name. Yeah, Dr. David Delvin, right? And he's the Neck Doctor. And what you want to look at is the thing called infection risk associated with oral sex. That is what you want to look at. So you can Google Dr. David Delvin, or you can Google infection risk associated with oral sex by Dr. David Delvin. Yeah, straight up. Yeah, man. Yeah, man. So those are the risks. So you can actually get let's recap. You can get what is it? What was the first one we talked about? HIV. You can get gonorrhea. You can get syphilis. You can get herpes, hepatitis A, B, and C. You can get chlamydia, and you can also get HPV. Yeah, the papilloma virus, whatever they call it, from oral sex. You could get it. You know, in all these cases, it's not 100%, but make sure that you're clean. Yeah, make sure you're clean, and make sure your partner is clean, and make sure you know the history of your partner before you have sex with them. It's the right thing to do. You know, limit risk. You know, if you're gonna do it, just do it with one partner, or make sure your partner you're doing it with, you know that they're clean. Yeah, you make sure that they're clean before you do it. And if you feel like there's a risk that you've taken, you go to the doctor right away and get swabbed and tested to make sure that you have not been exposed. Straight up, that's oral sex for you. Risk of STIs that you could get from oral sex. Last night we talked about the health benefit. Tonight we talk about STIs. So now you need to go to your doctor and get yourself checked in. You and your partner. And if both of you are clean, I say dive in. Enjoy it. Do cunnilingus. Do fellatio. Enjoy each other. That's what you are there to do, to please each other. Yes, but if you are infected with any STIs, please, I'm begging you, please don't spread the risk anymore. Open up and tell the person that you're with, and tell anybody else that you think you're gonna have sex with that you do, and give them that option of choosing whether or not they want to continue or not continue with you. That's the right thing to do. Any questions from anyone before I wrap up the show? I thought it was a good, informative show. Anyone have any questions? Let's see. Anyone have any questions? Yeah, man. Big up yourself, knowledge base. You there? No, knowledge base is gone. Yeah, man. Big up on yourself, man. I thought it was informative. What does anyone think? Anyone have any questions that they want to have? I thought Debbie would be here tonight, but I guess she's upset from last night as she has something to do. But Debbie and I, you know, yeah, man, we're good together. We're good. Yeah, man, we're good. Yeah, man, she know I love her and she loves me, so we don't have to worry about that. She just, once her head clear, she can come back. Yeah, we don't block people in this room, so she's not blocked. She can't come and say she got blocked. Yeah, so she can come and sit and enjoy and participate like she always does. And I won't treat her any different. And I hope she won't treat me any different. Yeah, so I love her. Yeah, she good. Yeah, man, any questions before I wrap up the show? Any questions before I wrap up the show? So I want to let the people know that tomorrow is when? Saturday? Yeah, tomorrow is Saturday. tomorrow and Saturday, Anthea said that she's gonna take the show tomorrow. She's gonna take the show tomorrow, and she wanted on Sunday as well. So this show is for all of us. This is not a bully pulpit. It's a shared space. So if you want a day on the show to present your thing or entertain, you can just let me know, and then you can come on and do your thing just the same as Anthea. She's gonna come on and do her thing tomorrow night. So it gives me a chance now to sit back and see what I'm still gonna moderate. So she's just gonna she's gonna present the show from where she is, and it's gonna be like a open dialogue kind of thing, and then with her topics, and then we bounce things off each other. So we're gonna see what Auntie has to bring tomorrow. So we look forward to that. But she has the forum tomorrow. And you get Delvin get a little break. But as usual, I'm always prepared with something. I'm ready to talk all the time. I'm like the radio. Always keep going. But Delvin, they're here to be famous. Very famous. And you guys are gonna lead me to fame. You guys are gonna give me fame. You just keep doing what you're doing, sharing the videos, and I will get there. I will get there. I will get there, and you're coming with me. You're coming with me, straight up. Man, straight up. Man, I was born to do this. I was born with talent, lots of talent. I don't even scratch the surface of the amount of talent that I have. So, man, but you guys are the ones who are gonna recognize my talent, and you guys gonna, through these videos, spread them. And the world is going to know about me, and they're going to know about the show, and they're going to know about you. And the bigger I get, you guys will be there with me every single step of the way. Because I love you guys. Man, you guys are my world. Man, my world, for real. Man, I love coming here to do this show for you. I was born to do this. Man, I was born to do this, so tell the truth. Man, so... I'm going to wrap up the show. So, remember, embrace conservative values. And we're law-abiding citizens, we're taxpayers. We don't have badges nor guns. So we have no choice but to support the people who pay to protect us, who are the police. So, people, support the police. Until tomorrow at 7 o'clock, Delvin saying, I love you. I love you. I love you, love you. I love you. I love you. Fight down war and crimes. Fight down war and crimes. Fight down war and crimes. And build up righteousness. Hail him now, Jah Rastafari. Jah Rastafari. Jah Rastafari. Preserve all people. Mwah, mwah.